On one hand, the knowledge of human genetics of lipoproteins has improved. On the other hand, the development of new type of drugs. Which is the contribution of this meeting of these themes?
The meeting you are alluding to is a meeting that precedes the European Atherosclerosis Society meeting in Prague and is supported by the Menarini Foundation. This meeting is aiming at addressing how genetics have empowered people in understanding mechanisms and the relation with possible target for therapy. Just to make an example, the PCSK9 story related to the inhibition of this protein has been confirmed and validated with genetic studies in Mendelian randomization studies. This is a very important first step because for the first time we are exploiting the information that we have in these wide studies of genetics to address the question whether a protein and or a mechanism will be a viable target for therapy. Examples will be given starting from PCSK9 but also moving to ApoC3 or angiopoietin-like 4, which are all targets that can be identified by these Mendelian randomization studies, taking advantage of the genetic information we have.
And it will be also a discussion and a sharing about the European Atherosclerosis Society guidelines on these epidemias.
Yeah, in the course of this meeting, which will be in one day, one part of the meeting will be devoted to the recently released guidelines for the detection and treatment of these lipidemias. This session will present what are the novelties there, what are the points that have been taken as standpoints by the two European societies, the European Atherosclerosis and the European Cardiology Societies, in addressing the targets for therapy. The target for therapies have been twofold. One is the LDL, which continues to be the main target, and the second one is the non-HDL cholesterol for people with diabetes and metabolic syndrome. In this case, this is a secondary target to take into account the totality of the lipoproteins that contribute to the risk of cardiovascular disease, and those are the ApoB containing lipoproteins. So this will be an important point to make clear to the audience. Finally, the goals. The goal is going to be at least 50% reduction of cholesterol or 70 milligrams per deciliter, whichever comes second. It is my pleasure to invite all of you to participate in this meeting, to take this opportunity to interact with the world-renowned expert in this area who will be able to provide to you the most recent information on how genetics interacts with the pharmacology and how we can use genetics to design new drugs for the control of these lipidemias. You will certainly be exposed to all this new information, as well as you will have the opportunity to talk and discuss with these leading people in the area all your doubts and get them clarified. Again, we look very much forward to welcome you in Prague in the next 23rd of April.